Okay, so I'm going to go over PBA Part 1 disease background. So I can use the internet resources, I can use my textbook. There is internet resources here for us as well as the EasyBib so we can continue to do our bibliography. So I'm going to click open these internet resources and I'm going to put those in a separate tab for myself. And that way I can have those again as a reference. Now, many of the diseases that I need to look up, I will be able to find here. The first place I want to get started though is this Merck Vet Manual. So I'm just going to go ahead and click there right away because I know that that's going to have some good basic knowledge for me. Alright, so now I'm going to come back over to my disease background and open up the actual assignment. So these are the expectations for this. So I'm going to make sure I write my name, date, session, all that jazz. Now I'm going to complete my research on the disease and to utilize in creating my media project, right? So my disease, I have pancreatitis. Whoop. Pancreatitis. So that's the disease I'm going to have. I can come over here, I can open up a new tab, and I can say pancreatitis, common name. So pancreatitis, that is the name, acute pancreatitis. Alright, cool. Pancreatic disease. So there's not really a different name for it. So I don't have to worry about that. So that's just going to stay here. Vector. Mosquito or tick of disease, common or scientific name. Pancreatitis is not caused by a vector or parasite. Okay. Is this disease infectious or non-infectious? Well, let me come over here to Merck Medical, and I'm going to look up pancreatitis. Okay. Alright, and I'm specifically going to look at pancreatitis in dogs. So, pancreatitis here is in dogs and cats. So let me start there. Alright, so I see what it is. It's letting me know. And then it's also letting me know what it can be caused from. So several risk factors are identified. Certain animals are predisposed to it. Dietary issues here. Some drugs. Alright, so there's a few different things, mainly by eating something, right? So mainly by ingestion is what's going to be causing that pancreatitis. Okay, so disease. Can I give my animal, can pancreatitis be contagious? No, it's not. So it is a non-infectious disease. Alright, and then is the disease caused by bacteria? No, it's not. Describe how the disease is transmitted between organisms. So the organism or the animal becomes infected with pancreatitis after ingesting something that might be rich or out of the ordinary. Okay, and I was able to get that from here in this information. Alright, so how is the disease spread, or how does the animal become infected with the disease? So I did kind of explain that up here with that, and so now it wants to describe it if it is from specific interactions amongst animals transmitted by the vector due to environmental condition. Paragraph 1, detailing the infection or contamination and growth process of the disease. So this is that part that's really important, is the growth process of the disease. So once an animal eats overly rich food, the body is unable to process, digest materials as it should, causing a what? Let's see. Similarities. I'm going to keep kind of going back into this. Clinical findings. So, diagnosis. This is all going to help me a little bit. Treatment. I'm going to come back up though to the information at hand. Alright, Alright, so inflammatory condition. So it's causing inflammatory response. Okay. All right, and then I can continue to keep going in that, right? So I'm going to kind of sum this up. Now notice I'm not going to copy and paste it. I am just going to summarize what's going on. All right, so what animal or animals does the disease affect? It can infect any animal, dogs, cats, even humans. So even humans can get this. And it is not zoonotic, as it comes from diet. Alright, so symptoms. Now here I'm going to go down. I'm going to find where it says symptoms of the disease. So here we have clinical findings. So clinical findings are going to be my symptoms of the disease. So here we have things that it's talking about: anorexia, vomiting, weakness, abdominal pain. So here's some symptoms. So some symptoms would be anorexia, and refusing to eat, pain in abdomen, pain in the abdomen, uncomfortable when weighing and being cut, okay, etc. So again, I am just summing up my clinical findings. So this summation of clinical findings. Okay, so that's what's going on for symptoms. Then diagnostic testing. So my diagnostic testing, I'm going to go again, continue what tests can be performed. Alright, so let's see. There's clinical findings, right? Imaging, and results from measurement of serum pancreatic lipase, immunoreactivity. Okay, so I can myriad into radiographs or a blood test. The blood test is, and then what is that blood test talking to? So here's more about your radiographs of what you want to look for. Ultrasound, I can also put that in there. An ultrasound can be performed. And then it'll also talk about that pancreatic lipase test that we're done, okay? And that's a blood exam. So here, in contrast to measure pancreatic lipase, is the specific measurement pancreatic lipase concentration in serum in a system of significant diagnostic tests. So we really want to do this blood test, right? So that absolutely is going to get talked about. And later, so here's the different types of tests that are given, and I can have that information in here. Alright, so all of this is going to get summed up and put into this box. Now I've got treatment. So now I'm going to go back down. Here's my treatment. Again, I'm going to read, and then I'm going to sum up. So I also want to include, costs if possible for the treatments. You can, if maybe some of you have had an animal stay at the hospital, you kind of have an idea of that, or you could go online and even check different websites of how much would it cost for an IV bag, of like what the actual just baseline costs are, not necessarily the markup. But do include different medications if there are any, if there were surgical procedures, anything of that nature. Here we generally are going to hospitalize for a lot of times, and abdominal intravenous fluids and things. So again, I'm going to read this and then I'm going to sum it up in here. Prognosis is like, what do you think is going to be the result of having it? Alright, and now we have prevention. So, prevention can be based off of all of this information, right? I can find that out. I can also see, so clinical diagnosis, treatment. There is no specific preventions, but oh look, if I come down, I can see a little bit more. And then this is going to be kind of, I can again dig further into here. I can go back into my internet resources. I can see if I have another website that might be helpful. I'm not dealing with a parasite, so I don't need to worry about that. I can go into Science Direct and see what I've got going on. Otherwise, I can kind of surmise if it's a dietary thing, what am I going to do, right? So, use your nativity along with research to determine some diseases you might not be able to prevent. Like they may not have a medical preventative, where like there's no medical preventative for pancreatitis, it's just a matter of watching what the animal's eating. Okay, and then here's the management methods. So this is really, let's see if I can type it that way. This is the synthesized learning, right? So here we're really putting together a plan to make sure that the animal does not get pancreatitis, or if they do, how can you mitigate the symptoms, or like stop those symptoms right away, right? So we're exploring what scientists are doing. We can do different studies. Maybe there's different foods out there that I want to look up, so I can just do a Google search. So I'm going to go to Google, and maybe I'm going to do management of pancreatitis in dogs, and then see what comes up. Okay, so here's treatments, here's diagnosis information, here's symptoms, treatments, and prevention. Oh, AKC has something. So I'm going to go and click on that website and see what it has to offer me. Okay, oh, there's a cool, oh my gosh, this is awesome. There's a video on it, so maybe I'm going to watch the video and see what I can do and what information that has on for me, okay? So I'm also going to take this, because I'm going to use some of this information on management, I'm going to take that website and I'm going to copy it, and see how it says 2 different websites. I'm going to paste that there. I also used Merck, so I'm going to copy that. I'm going to paste that there. Image of infected animal or pathogen. Now, I'm not really going to be able, if I do a Google search for animal that has pancreatitis, so my Google search is animal that has pancreatitis. I look at images. Now, I really don't know if, like, that animal has pancreatitis, right? But maybe there's some really cool images. Here's it showing the pancreas, your liver, small intestine. Here's at least where it's at. So I could use that image. I could also see what else is kind of going on. That keeps looking at the location. So that would be fine to use for your picture, because it's giving you a location of it, because there is no actual pathogen that you could use. Here's symptoms, so maybe you want to include that. So if I'm going to do that, here's my image search, but now I'm actually going to open up that link. I'm going to copy it because I'm going to use that image. Oh. Okay, so then this is where that's at. So I'm actually going to insert that is where my picture came from. And I'm going to make sure I then can copy that image and put that down. I also want to say that this diagram, because I'm going to read a little bit more. Okay, so this diagram is telling me about the different symptoms if an animal has pancreatitis. So this diagram shows symptoms. And that would be a successful completion.